Welcome to Pediatric Case Review. Today's lecture provides a comprehensive clinical review of Turner syndrome, covering diagnosis, management, and long-term care strategies. This presentation is designed for healthcare professionals seeking advanced knowledge in pediatric endocrinology and genetics. A 14-year-old female presents with short stature and absent menstruation. Her height is 142 centimeters, below the 3rd percentile, with no breast development. What is the most likely chromosomal finding? Option A, 47XXY. Option B, 45X. Option C, 47XXX. Option D, 46XX with fragile X. The correct answer is B, 45X. This represents classic Turner syndrome, found in approximately 50% of cases. Mosaicism patterns like 45X/46XX occur in 30 to 40%. Short stature and primary amenorrhea are cardinal features resulting from ovarian dysgenesis, which leads to hypergonadotropic hypogonadism. Option A represents Klinefelter syndrome in males. A newborn female presents with lymphedema of hands and feet and webbed neck. Coarctation of the aorta has been diagnosed. What percentage of Turner syndrome patients have congenital heart defects? Option A, 10 to 15%. Option B, 25 to 30%. Option C, 45 to 50%. Option D, 65 to 70%. The correct answer is C, 45 to 50% of Turner syndrome patients have cardiovascular anomalies. The most common is bicuspid aortic valve at 30%, followed by coarctation at 15%. Other defects include aortic stenosis and partial anomalous pulmonary venous return. Lifelong cardiac monitoring is essential for all patients. An 8-year-old girl with Turner syndrome has recurrent otitis media episodes. Hearing assessment is requested with no previous audiological evaluation. What type of hearing loss is most common in Turner syndrome? Option A, high-frequency sensorineural. Option B, low-frequency sensorineural. Option C, conductive hearing loss. Option D, mixed hearing loss. The correct answer is C. Conductive hearing loss is most common in childhood, affecting 60 to 90% of patients. This results from recurrent otitis media and structural ear anomalies. However, sensorineural hearing loss develops progressively with age, particularly affecting high frequencies. Annual audiometry is recommended for all Turner syndrome patients. A 16-year-old with Turner syndrome complains of social anxiety and difficulty with spatial tasks and mathematics. Her verbal intelligence is normal. Which cognitive profile is most characteristic? Option A, global intellectual disability. Option B, verbal deficits with preserved nonverbal skills. Option C, nonverbal learning disability with preserved verbal skills. Option D, executive function deficits only. The correct answer is C, nonverbal learning disability with preserved verbal skills. This is the typical cognitive profile in Turner syndrome. Patients show preserved or superior verbal abilities but have deficits in visual spatial processing, mathematics, and executive function. Social cognition challenges are common. Early neuropsychological assessment and targeted interventions significantly improve outcomes. During newborn examination, a low posterior hairline is noted with webbed neck and multiple pigmented nevi. What is the medical term for webbed neck in Turner syndrome? Option A, cervical lymphangioma. Option B, pterygium colli. Option C, hygroma. Option D, nuchal fold. The correct answer is B, pterygium colli, which describes webbing extending from the mastoid to the acromion. This results from residual cystic hygroma during the fetal period and is present in 25 to 40% of patients. It is associated with increased nuchal translucency on prenatal ultrasound, often the first sign leading to diagnosis. During physical examination of a 10-year-old, a shield-shaped chest is noted with widely spaced nipples and increased carrying angle at the elbows. What is the term for increased carrying angle at the elbow? Option A, cubitus varus. Option B, cubitus valgus. Option C, genu valgum. Option D, elbow hyperextension. The correct answer is B, cubitus valgus, which is an increased carrying angle greater than 15 degrees. This is present in 50 to 70% of Turner syndrome patients, resulting from abnormal bone development at the elbow. The shield chest and widely spaced nipples are also part of the characteristic skeletal phenotype seen in this condition. A 12-year-old Turner syndrome patient undergoes routine examination. Short fourth metacarpals are noted bilaterally with no pain or functional limitation. What percentage of Turner syndrome patients have short fourth metacarpals? Option A, 10 to 20%. Option B, 35 to 50%. Option C, 65 to 75%. Option D, 85 to 90%. The correct answer is B. 35 to 50% of patients have short fourth metacarpals. This finding is also called brachymetacarpia or brachydactyly and can affect both fourth and fifth metacarpals. While usually asymptomatic, it aids in clinical recognition and is part of the skeletal phenotype assessment in Turner syndrome. An infant with Turner syndrome undergoes hands and feet examination. Convex fingernails are observed with hyperconvex, upturned nails. What is the term for this nail finding? Option A, koilonychia. Option B, onycholysis. Option C, nail dysplasia with hyperconvexity. Option D, Bowes lines. The correct answer is C, nail dysplasia with hyperconvexity. Hyperconvex nails are a common finding in Turner syndrome, representing the opposite of koilonychia or spoon nails. This may be present from birth and is part of the ectodermal manifestations. Koilonychia would show concave, not convex, nails. During a genetic counseling session, parents ask about recurrence risk. Their previous child has 45X karyotype and parental karyotypes are normal. What is the recurrence risk for future pregnancies? Option A, less than 1%. Option B, 10 to 15%. Option C, 25%. Option D, 50%. The correct answer is A, less than 1%. Turner syndrome is usually a sporadic event with recurrence risk below 1% when parental karyotypes are normal. It results from random non-disjunction during meiosis. Unlike Down syndrome, increased maternal age is not a significant risk factor for Turner syndrome recurrence. During a research discussion on short stature mechanism in Turner syndrome, the SHOX gene function is reviewed. It is located on the pseudoautosomal region, loss of which gene primarily causes short stature in Turner syndrome. Option A, FGFR3 gene. Option B, GH1 gene. Option C, SHOX gene. Option D, IGF1 gene. The correct answer is C, the SHOX gene, which stands for short stature homeobox gene. Located on the pseudoautosomal region of the X chromosome, its haploinsufficiency causes short stature and skeletal abnormalities in Turner syndrome. This gene also contributes to cubitus valgus and Madelung deformity when deficient. A 5-year-old with suspected Turner syndrome presents with height below the first percentile. An initial diagnostic test is ordered. What is the gold standard diagnostic test? Option A, peripheral blood karyotype. Option B, fluorescence in situ hybridization. Option C, microarray analysis. Option D, hormone levels including follicle-stimulating hormone and luteinizing hormone. The correct answer is A, peripheral blood karyotype is the gold standard, analyzing at least 30 cells. This detects mosaicism and structural abnormalities. While fluorescence in situ hybridization provides rapid results, it may miss mosaicism. If blood karyotype is normal but suspicion remains high, consider skin fibroblast karyotype for occult mosaicism. A 7-year-old with newly diagnosed Turner syndrome requires cardiac evaluation. No symptoms are present. What is the recommended initial cardiac imaging? Option A, chest X-ray only. Option B, electrocardiogram only. Option C, echocardiography. Option D, cardiac magnetic resonance imaging for all patients. The correct answer is C. Echocardiography is the initial screening for all patients at diagnosis. This evaluates for bicuspid aortic valve, coarctation, and other cardiac defects. Cardiac magnetic resonance imaging is reserved for complex cases or detailed aortic assessment. Repeat echocardiography is recommended every 5 to 10 years in adulthood. A 13-year-old Turner syndrome patient undergoes routine laboratory monitoring and screening for associated conditions during annual evaluation. Which laboratory test should be performed annually? Option A, complete blood count. Option B, thyroid function tests. Option C, vitamin D level. Option D, lipid panel. The correct answer is B, thyroid function tests should be performed annually. Thyroid dysfunction is present in 15 to 30% of patients, primarily autoimmune hypothyroidism or Hashimoto's thyroiditis. Annual thyroid stimulating hormone screening is recommended. Additionally, monitor celiac disease antibodies, liver function, and glucose metabolism as part of comprehensive care. A 6-year-old Turner syndrome patient shows declining height velocity with progressive deviation on the growth chart. Parents request growth intervention. At what age should growth hormone therapy typically begin? Option A, when height drops below 50th percentile. Option B, at diagnosis if height below 5th percentile. Option C, only after age 10 years. Option D, when final adult height prediction is below 150 centimeters. The correct answer is B, begin at diagnosis if height is below the 5th percentile, typically between 4 and 6 years of age. Growth hormone is FDA approved for Turner syndrome at a dose of 0.0 0.375 milligrams per kilogram per week, higher than standard growth hormone deficiency dosing. Treatment typically results in approximately 5 to 10 centimeters gain in final adult height. A 14-year-old Turner syndrome patient has no spontaneous puberty with elevated follicle-stimulating hormone at 89 milli-international units per milliliter and luteinizing hormone at 42 milli-international units per milliliter. At what age should estrogen replacement typically be initiated? Option A, 10 to 11 years. Option B, 11 to 12 years. Option C, 13 to 14 years. Option D, 15 to 16 years. The correct answer is B, 11 to 12 years, which matches physiologic puberty timing. Begin with low-dose estrogen at 1/8 to 1/4 adult dose, then gradually increase over 2 to 3 years. Add progestin after breakthrough bleeding occurs or after 2 years of estrogen therapy to protect the endometrium and establish regular cycles. A 28-year-old Turner syndrome patient desires biological children but has absent spontaneous menstruation. Options are discussed with a fertility specialist. What is the recommended fertility option? Option A, ovulation induction with clomiphene. Option B, in vitro fertilization with own eggs. Option C, oocyte donation with in vitro fertilization. Option D, adoption only. The correct answer is C, oocyte donation with in vitro fertilization is the most successful option. Premature ovarian insufficiency affects 90 to 95% of patients. Spontaneous pregnancy is rare, occurring in only 2 to 5%, primarily in mosaic patients. Comprehensive cardiac evaluation is mandatory before any pregnancy attempt due to high-risk status. A 35-year-old Turner syndrome patient presents for routine follow-up with blood pressure of 158/92 millimeters of mercury. She was previously normotensive. What percentage of adults with Turner syndrome develop hypertension? Option A, 10 to 15%. Option B, 25 to 30%. Option C, 40 to 60%. Option D, 75 to 80%. The correct answer is C, 40 to 60% of adults with Turner syndrome develop hypertension, often in early adulthood. Mechanisms include vascular dysfunction, renal abnormalities, and undiagnosed or repaired coarctation. Regular blood pressure monitoring and early treatment are essential to reduce cardiovascular complications and improve long-term outcomes. A 22-year-old Turner syndrome patient presents to the emergency department with severe chest pain and back pain. Blood pressure is 180/100 millimeters of mercury. What is the most life-threatening cardiovascular complication? Option A, myocardial infarction. Option B, aortic dissection. Option C, pulmonary embolism. Option D, endocarditis. The correct answer is B, aortic dissection carries 40 times higher risk in Turner syndrome compared to the general population. Risk factors include bicuspid aortic valve, coarctation, hypertension, and pregnancy. Mortality reaches 40 to 70% if untreated. Regular aortic monitoring with magnetic resonance imaging is mandatory, especially before and during pregnancy. An 18-year-old Turner syndrome patient undergoes glucose tolerance testing. Her fasting glucose is 98 milligrams per deciliter with a family history of diabetes. What is the risk of developing type 2 diabetes compared to the general population? Option A, no increased risk. Option B, 2 to 3 times increased. Option C, 4 to 5 times increased. Option D, 10 times increased. The correct answer is C, 4 to 5 times increased risk of type 2 diabetes. Mechanisms include insulin resistance, increased obesity prevalence, and metabolic syndrome. Screening should include annual fasting glucose or hemoglobin A1C starting in adolescence. Perform glucose tolerance testing if impaired fasting glucose is detected for early intervention. A 25-year-old Turner syndrome patient has elevated liver enzymes with aspartate aminotransferase 78 units per liter and alanine aminotransferase 92 units per liter. She has no alcohol use or hepatitis. What liver condition is associated with Turner syndrome? Option A, autoimmune hepatitis. Option B, non-alcoholic fatty liver disease. Option C, primary biliary cirrhosis. Option D, Wilson disease. The correct answer is B, non-alcoholic fatty liver disease is significantly increased in Turner syndrome. This relates to higher rates of obesity, insulin resistance, and metabolic syndrome. Additionally, patients show increased rates of liver cirrhosis and nodular regenerative hyperplasia. Regular liver enzyme monitoring is recommended as part of comprehensive care. Turner syndrome requires lifelong multidisciplinary care involving endocrinology, cardiology, and other specialties. Early diagnosis and appropriate treatment significantly improve outcomes and quality of life. Regular monitoring for associated complications is essential throughout life. Thank you for watching Pediatric Case Review. Please subscribe to our channel for more informative presentations and feel free to comment with any questions.